Hi, folks. So, my name is Nicky Coleman. I live in Bristol in the UK, and for the last 3 years, I've been suffering from a type of unknown, undiagnosed viral infection. I was working in a factory about 3 years ago, and I felt this flu-like symptoms. I was very ill with it, and I had these bad fevers for a few months. And right from the beginning, I had this swollen, stiff neck, and also all around my face getting this inflammation. And that's continued for 3 years, actually. It's a type of bacteria or virus, and I don't know what kind. And the doctors did lots of blood and mucus tests at the time to try and determine the cause, the type of infection. They were never able to determine one, though. And after the fevers subsided, the inflammation of both the lungs and the neck and the menges, the face areas, that continued. And so I continued getting headaches and my neck being swollen and my nose blocked and my eye gets inflamed. It feels like there's something behind there. And what happens is the virus produces all these mycotoxins within this mucus. And it's a very thick, kind of gloopy, almost glue-like mucus. It's got a thick plasticity to it. And 3 years ago, I felt I was bringing up this mucus. I felt it on my lungs. And it's got a very bitter metallic taste to it when it's brought up on a dry throat. And so I know it was like every other viral infection that I've had before, except this viral infection never cleared up. After a few weeks that I was signed off work from the factory job, I thought it would just clear up. It never did. It lingered on for months, and the symptoms were so bad. The fevers did subside, but the swollen, inflamed neck and face and the lungs never did. I was able to go back to work, but I had to change my job because of that. I went to a less physically demanding job as a kitchen porter because I could no longer do the long hours of the factory, and I couldn't go on cycling or rambling holidays. I couldn't work out the way I did. I worked as long as I could, 2 years with the unknown viral infection. I went out on day trips, I went on protests for it. I kept as active as I could with it. I was furloughed some of the time, but when I was at work as a kitchen porter, when it was open, I went in as often as I could. And I kept going out and exercising and socializing and working as much as I could for 2 years with it. And then about a year ago, 2 years into the chronic viral infection, then it progressed again and it changed. I felt this sharp pain in my upper right lung, almost a stabbing pain, and it was viral pleurisy, and the pain then migrated southward to the lower part of the pleura. That's the outer lining of the lung walls. And then the virus had broken out of the lungs and was then very tender to touch at the edges of the lungs. And since then, for the last year, I've also had a lot of pains in the lower part of the body, around the pelvic region, down here where the stomach area is, actually. And so that then hurts if I'm going to the toilets or if I'm going out or bending or stretching, and if I walk or do any kind of exercise excessively. So for that reason, the last year I've not been able to go to work or to do anything sustainably. I've not been able to work regularly. So I've been out of work for 1 year now with the viral pleurisy. But the actual virus is still in the neck and in the head and also in the menges. It affects my eyes and my nose and my mouth and throat. And all the excessive gluey viral mucus I bring up every day. So I'm caught in a daily cycle, really, where I'm struggling every day against the viral inflammation. And the inflammation causes the pain in the neck and around the face and in the head and in the lungs. And for the last year, also in the pleurisy and around the pelvic region as well. So for that reason, I'm not being able to carry on working. But I've not been able to carry on doing much, really, to be honest, because a lot of the time I'm having to be at home resting with it, because the body is struggling against the virus. It is struggling against the viral mucus that is produced every day of it. And I am having to push out and do stretching exercises and they have not been able to find what kind of virus it is. They found no diagnosis because they could never know the type of virus, sadly. So there's no known treatment because they don't know the type of virus that it is. They don't know the type of infection. So there's no known treatment with it. All I've been trying to do is to cope with the symptoms as well as I can, really. And so I tried to keep working as much as I could for 2 years with it. But then when it broke out of the lungs and it went into the pleural and it went into the pelvic region, and the pains were then in multiple parts of the body, I was then limited how much exercise I could do. I go out still as much as I can, a few times a week. I go out and do my own shopping. I wash and cook and clean for myself. I do as much as I can. But I can't go out walking miles like I used to. I can't work like I used to, really, because the virus has progressed and the symptoms of it have multiplied since then. So I still carry on as much as I can, but I'm much more limited now in what I'm able to do. And I haven't been able to treat it, except that I was treating the symptoms of it. And I was doing that with some sort of antiviral herbs like oregano extract, for example. I've been using that, and that helps flush out some of the actual mucus that's produced. So I've been pushing out some of the mucus by treating it, treating the symptoms. It's just trying to cope with the symptoms as well as I can, really. And then recently, because I was also studying to try and find the treatment desperately, of course, because the doctors can't offer me any treatment, so there's no hope. There's no realistic chance of any treatment for that. So there's been no hope for me going back to work or having relationships again, or going out and socializing with other people again. I've had a year without working, but a year without being able to go out and see friends. I haven't been able to go out. I have not had anything, really. I've gone out once or twice, but I've gone out in a lot of pain, and I did that really to go out and say goodbye to other people, really. And I'm not able to go out because it causes excessive pains when I do go out. So therefore, I just limit myself just to going out for essential food and medicines, really, just because I've got to cope, really. I try and do as much exercise as I can, but I'm in pain doing that, really. So I can't go out socializing for that reason. I talk to people on the phone as much as I can. I'm trying to research as much as I can possible treatments to treat this infection, to free me from this viral prison that I'm living in, really. Just to get back to living again, because I'm living like a zombie. I'm not living, really. It's not true living. I'm not really, I don't live properly. I don't function properly anymore. I'm at home resting most of the time, really. There's a few exceptions where I've been able to go out and do a few things this year, but on the whole, mostly, for the majority of the time, I'm housebound and I'm trapped at home with it, really. I live like a zombie. That is to say, I don't really live with it. So out of desperation, of course, I've been researching, trying to look for as many different treatments. And I looked for a lot of herbal treatments. And I know that there's a few other herbal treatments that could help me to function better in my life. There are antiviral treatments that would at least allow me to treat some of the symptoms, if not to treat the causes of the actual symptoms themselves. So like with the oregano extract, that helps me to push out some of the excessive mucus that the virus produces. I would really like to just get a few herbs that are antiviral, antimicrobial, that are proven to work on a number of different infections. And I know the oregano worked with my infection, and it's quite likely that a few other antiviral herbs and antimicrobial herbs that work on other conditions that have similar symptoms, that work with other chronic infections, that those also could help me to function much more and just to go out occasionally, to see a few people, just to work part-time even. So I know that some money could actually help me to have and invest in antimicrobial, antiviral herbs that actually could allow me to function, maybe to work part-time, to go out and have a few relationships, just to see a few people, just to see a few family and friends that I've not been able to see because I'm so overwhelmed with the sheer amount of symptoms in different places within my body now. But also, I've researched and found other treatments more recently that have also treated other conditions with very similar symptoms to my own, and actually have allowed some people to heal from those conditions or to alleviate their suffering to a greater extent. And what I've been looking at specifically It's called this red light near ultraviolet wavelength, and it's a light therapy. It goes by a number of different names, actually, but it's commonly known as red light therapy treatment. And what it does, it sends these light waves through wavelengths into the body, and it helps the cells in the lower part of the body to rejuvenate. So it helps the cells in healing process. It helps those cells to regenerate, to build up more cells. And that's so important for someone suffering from a long-term chronic infection, and with all the inflammation that will come with. Because my cells are often, they are invaded by the viral toxin cells of the viral mycotoxins. So many of my cells are suffering from the inflammation of the virus that I need a lot of help to try and rebuild and restore and regenerate some of those cells that are dying because of the viral inflammation that I'm suffering daily. And so I know from a lot of research that that red light could actually help and has helped with a large number of other chronic infections. I know from research and from the forum groups that I was researching, like people suffering from Lyme disease and a number of other co-infections like Borrelia or Babesia, other long-term co-infections and pathogens that cause these inflammations in the bodies have also been healed up as a result of the red light therapy treatments. And so it's reasonable to think if it's healed up other conditions that have similar symptoms of mine, like the inflammation, and it's possible that it could actually help me with my long-term infection, that either it could allow me to actually deal with the symptoms a lot better, it could rejuvenate the body cells when they are so depleted as a result of the viral inflammation, or it could actually heal up and help to actually heal the viral inflammation itself. Um, I don't know, because it's an unknown type of viral infection and I don't know the strain of the infection. I don't know how much it will help to heal, whether it would fully heal it or just allow the body to regenerate cells, rather than just being, killed off by the virus so much, or inflected and inflamed by the virus, as it is currently on a daily basis. It might help rejuvenate and to heal the body enough to allow it to function more, or it might actually heal up entirely from the virus. But either way, I know from a lot of research it helped a lot of people suffering from chronic viral diseases. And mine has spread to such an extent now that I really am spending most of the time now, the vast majority of the time at home now, because I am just overwhelmed with the amount of symptoms of it. I suffer every day. Every day I suffer from the inflammation of the neck, of my face, and that causes eye strain, it causes headaches. My whole nose is blocked up with the actual viral mucus. My neck hurts even to move it. So I really have to prop up the neck just to move it one way or the other way when I'm getting the inflammation really hurts. And I've got a river of viral mucus that just pours out of my nose, blocks up my nasal passage, it blocks up my eyes, stinging my eyes. I get the headaches, the eye strain, the neck pain, and then the lung pains on top of the pleural pains, and then the pains in the lower part of the body are causing me pains when I'm toileting, when I'm bending, when I'm moving, when I'm walking. And I'm just overwhelmed as the symptoms have grown from 5 or 6 things in 2 or 3 places in the body to 3 or 5 places in the body now, with 7 or 8 and then 9 or 10 symptoms as the disease has progressed over the 3 years, and especially over the last year since it's become viral pleurisy. I am now becoming so overwhelmed that it's a struggle to go out and do that much at all, really. Just to go out and get the essential food and medicine, to cook, clean and wash myself. That alone is really a struggle. So I really need some sort of support in dealing, my body needs support to deal with this viral mucusy, the viral mucus that has spread and that has progressed, and I am desperate, to be honest, and for that reason why I'm making my appeal, and a last resort, because I don't know what else to do, and I am desperate with it, really. For many years, I worked for about 7 or 8 years as a shop assistant, as an usher, as a paper boy. I worked in telesales for 5 years, helping people on the phone, as a customer service assistant. And I worked for a number of years doing a variety of jobs. I was a home care assistant, helping the people with vulnerabilities, helping other people with illnesses, to do shopping, cooking, cleaning, washing, giving medications, and just befriending people at home, I suppose, with different illnesses, disabilities. And I also worked on a farm. And the last 2 years, I worked in a factory as a recycling operative. And my last job with the virus was as a kitchen porter in a busy restaurant. So I worked for about 15 years of my life doing a variety of different jobs. I had a lot of different relationships, with family, and a lot of different friendships, and I'm sad for them and me that we've not been able to carry on those relationships, that it's been that impacted by it all, really. And a lot of other voluntary projects that have been affected by it as well, really. And so I want to get back to working, get back to having relationships, and get on with my life, really, that's been on pause and stagnating and malingering for a year now. And that I've really not been able to do that much, that I've been severely limited because the disease progressed and there is no treatment to progress. And so I'm desperate to find this treatment. And this seems like it could well be a treatment, and it seems like it's affordable as well. It's something that could be done. It's very low risk. It's shown that it's not a risk to the body that much, and it has been proven to be a benefit to many people that have suffered similar conditions that are also progressively bad and degenerative. And it's been able to help a lot of other people with very desperately difficult conditions, people with late stage Lyme disease, where they also are suffering from other co-infections often, that are really severely suffering in their lives and struggling to live much of a quality of life, really, just about making it, struggling through, I suppose, without much of a quality of life, really, without being able to work at all much, and without being able to have relationships much at all, really. It's been able to help a lot of other people with serious chronic infections, and so there's a reason to suspect it might be able to help me with my infection too. And so I'm hoping to try that, and I hope that it will work. There's a good chance it could improve. There's a good chance it will improve the quality of my life, actually. Whether it will totally heal the condition itself, I don't know, but there's a good chance that it will. But at the very least, it will improve the quality of my life, if it has done for many others with similar other conditions, with very similar conditions that cause very similar symptoms. And so that's why I'm making the appeal to the public, really, that this treatment, it is an experimental treatment. There's not enough medical research to say categorically, absolutely, that it will work. And also because what I have is an unknown type of infection as well. But nevertheless, the fact that it has been proven to work on a number of other similar chronic infections. There's a lot of subjective, though it is, but there's a lot of testimonial evidence. A lot of people are reporting that they've received benefits that have suffered from chronic infections similar to my own. You know, I've been suffering from this for a year and desperate and not knowing what to do. I've tried a herbalist, and I've tried a number of different herbal antiviral things. I spent a lot of my money when I was able to work on trying to treat myself, trying out a lot of different experimental treatments. I tried out lots of different herbs. Some of them, like the oregano, worked, and a number didn't. I haven't been able to try any other things. The doctors have looked and they've tried and they've done blood tests and mucus tests, but they were just not able to identify and to diagnose the type of infection that I'm living with. So they don't know any treatment, and they don't. So I really want to try this treatment as a last resort, because there's nothing else. I have no other hope. And so if this doesn't work, then I don't know, I'll carry on looking desperately for something else perhaps, and I hope there might be something else. I just don't know. To hire out the actual red light laser therapy, to hire out the equipment for it would cost roughly about £70 per week to hire out the equipment to use at home. The initial deposit for that equipment would be roughly £350 to £400, but that money would be returned once the equipment had been used after about 3 or 4 months. They recommend the treatment could last 1, 2, 3, up to 4 months. They would recommend the treatment for long-term chronic infection. And so that would be £300 or £400, and then the deposit money to hire out the actual equipment to begin with too. So the money I would be asking for is to hire the equipment for the therapy itself, for the red light therapy that would penetrate deep into the body and help to regenerate the body itself, to help it regenerate the cells and to help restore the body that is suffering from the viral inflammation at the moment, that is progressive and progressed within the body now. So yeah, that's what I'm asking for it for, and I would be honest with everyone about what happens with it and update everyone regularly about what happens and how it's progressing and how much I'm able to go out. And I would continue doing the herbal treatments that I know have been effective as well. The oregano treatment that helps the body to push out the excessive mucus. And I would carry on doing physical exercises, going out, stretching, pushing, and doing as much of the physical exercises as I could to keep the body as fit and well as I can, and to try and treat it as well. And I would update people on the progress as much as I could, and I would make a promise to be as honest and truthful and transparent as I can be. And I will keep people regularly updated on how it progresses, and hopefully there will be good news at the end of it. Hopefully I'll get the treatment and I'll go on to a new job, and I'll go on to live and work and to serve other people. And if I don't return to my old home care job, I'll go on to a new home care job and caring and learning in a different way. And I hope that's what it will be. And that's my goal, to return to living and working and studying with people and for people again. Well, that's my whole appeal in a nutshell. That's the story. I'm sorry that it was dreadfully long, but it's a long story. It's been 3 years that I've had this viral infection. It's been 1 year now with the viral pleurisy. I've been looking for treatment, but I've not had any savings of my own money to go into it. The doctors themselves don't know what the infection is, so they're not able to treat it either. So I've got to try and find a treatment for it, or there won't be any treatments. Because after 3 years, the body will not treat it. It does not know how to. It has progressed a year. It will continue malingering probably, because it has done for a year with it. I hope I won't get another secondary infection. It took me a long time to get over one, but I try not to get anything, and I try not to worry about those things. But I'll continue malingering with it as much as I can. But I hope it can be treated and I can get back to working and living again, really. That's my great hope. I can get back to loving and living and struggling with people and all the other things that we want to do as people. You know, things that are a struggle sometimes, but of a great benefit for other people as well as me. And I hope there can be. I hope there can be a treatment, and I will keep people updated, and I will be as honest as I can be and give people regular updates about how things are going with it. And I promise I will do that. And I will return any money that I can from hiring out the equipment for the treatments. And I promise I will work as hard as I can after the treatments to get back to working, or to go on to other work actually. And to use whatever skills or services I can in the service of humans again. Not just for my own benefit, but for others. Not just for my friends and my family's benefit, but for society too, I hope. You know, like in home care work, but I hope other work that will serve society. You know, to serve myself and my family, God, Queen and country, I suppose. To serve everyone, I hope, really. So that's my hope, really, to go on to live again. And I will promise to keep people updated about how it goes, really, how the treatment goes, if I manage to get it. That's all I can do. Well, thanks for listening.